So, my topic is excited delirium. I chose this topic because I think it is very interesting in our field, and it actually ends up being a lot of patient deaths in our field when it comes to delirium. Excited delirium tends to kill 2/3 of its patients, either on scene or during transportation to a hospital, and later on killing the last 1/3 into the hospital due to renal failure, dysrhythmias, and such high amounts of dopamine would cause damage to the brain. I think it's something that we miscategorize a lot while out on a call, and we just put it as a psych patient because a lot of time, a lot of people will die either in our ambulance or in the back of a police car, thinking that they are just being an agitated person. There's excited delirium. It is, by definition, is a distinct clinical syndrome associated with a stimulant drug use or underlying psychiatric illness, which results in agitation, hyperactivity, impaired sensory perception, and metabolic derangements. This will correlate with symptoms of being disoriented, violent towards other people. It'll be sudden onset, it'll be quick, bizarre behavior. They'll be paranoid with delusions, hallucinations, and have hyperthermia along with tachycardia. Now, they will also have their fight or flight response, where they will be pumped full of adrenaline and dopamine at that time. So this is where they also get inhuman strength, and that is through the amount of adrenaline and dopamine, which they do not perceive the pain as they normally would if they were not doped up on it. And it makes it very difficult to be able to subdue or get these patients calm. A lot of times we will try to subdue these people in a manner that is not appropriate or that is in their best patient care. And the best way to do it is actually through having a group of people, not just a few people, because these people can be very strong and can possibly harm us. And our first priority is protecting us and our partners, and then come the patient. So it's best to have you, your partner, firefighters, and police to help restrain the patient long enough to either put a chemical restraint or a physical restraint on them. But be careful with physical restraints. They have been known to dislocate shoulders, hips during that time. And for their life, do not place them prone, and do not put any sort of restriction device around their waist. Do not put any pressure around their chest or neck, like kneeling on them while on the ground, because this can lead to a respiratory arrest, because during this, they're going to have a large amount of muscle usage whenever they're so excited. So their body is putting out a lot of lactic acid, which causes the body to go to metabolic acidosis and having electrolyte imbalance. And if there is a stimulant in the system, the mental and metabolic imbalances are even further exaggerated. They can also exhibit temperatures all the way up to 106 degrees Fahrenheit, and you'll feel it. They'll be sweating, they'll be red, and this is also, you'll catch them possibly stripping off their clothes, getting naked. It's very similar to PCP in that way. And so a lot of people think they are 100% just doped up on drugs whenever they are producing so much dopamine or serotonin, which studies have found that people who are chronic users of a drug, cocaine, will tend to have more dopamine receptors to be able to take out the dopamine. And on people they find in excited delirium, they will end up not having that many and causing them to go into a distress. So the best things to do is try to calm the patient, possibly try to talk with them, de-escalate the situation as best as possible. Give oxygen to them as well to compensate for whatever respiratory, if they go into respiratory failure or if they're not adequately breathing enough for themselves. Check blood glucose if you have time or if you think it is pertinent to the situation, and then do rapid cooling of the patient once you find them. Give them water if they're not nauseous or vomiting. They're going to be really dehydrated from how much muscle usage they're going to be doing. You can cool them off with ice packs or wet cloths in the neck, groin, and armpits. Medication usage to help sedate the people or use a chemical restraint on them is Haldol with 5 milligrams IM. This can take up to 5 to 10 minutes to start showing effects. It does help with the heat. You can give Versed, which you can give 5 milligrams as well, or you can do it in two dosage of 2.5. And consider giving them some fluids, like 500 mils of normal saline, and you can give this all the way up to 2 liters. It's just tritrate to effect to help them out. Start thinking about an advanced airway if they are becoming more lethargic and not responding to you as much. They possibly are heading into respiratory arrest or cardiogenic, or have a lethal dysrhythmia. As one of the other things you need to be looking for, and should put a 12 lead on them too, is another cause of excited delirium, which will cause death. There, out of 8 out of 10 people they were able to do a study on, most of them will be on some sort of stimulant, and it is found they will have higher levels of dopamine and serotonin in them. The 2 that are not on them, it is still unknown exactly what causes it, but they do bear in the same way that they had a high dopamine and serotonin levels. They'll typically be found in bathrooms with towels all over them, trying to cool off. Sadly, a lot of these people do end up passing away because their body is not able to compensate from all the misfirings and chemicals inside of the body. So it's really just important to see what it is, give them proper treatment, still treat them like a human as best as you can. They will be agitated and aggressive, so take care of yourself first of all. You need to manage their airway the most importantly, because that is the number leading cause. We don't need another possible George Floyd scenario where we have mishap, and this happens all the time, multiple times. It's not just one time, it has happened before, and it's something that us as an EMS system, police, firefighter, we need to get to know better, and how to treat these patients to make sure that they are getting home back safely. positional asphyxiation is the number one cause that will kill these people. So how you place them and how you move them. If you need to restrain them, put them on a backboard. This will help restrain them, and you can use lateral restraints, which is like this. It will limit them in their movement, but it still gives you, as a paramedic, the ability to move them over in case they start vomiting, and you can clear that airway to make sure they have a good airway. Lastly, good documentation is the best thing you could ever do in this situation, because it's more than likely this might end up in law enforcement's hands, a possible judge or court, or God forbid, your medical director. By showing vital signs like SpO2, CAPNO, all that stuff is improving. Respiratory rate, showing that you gave proper care and treatment is the best thing you can do. And that is my discussion.